prevention and treatment of AIDS. AIDS is the final stage of HIV infection. HIV is a retrovirus, single-stranded RNA virus, which destroy, attack immune system of the human body, especially CD4 and T cells. They are the sufferer. These viruses come from unprotected sex, from drug addicts, use of sharing or shared syringes, unscreened HIV positive donors of blood during blood transfusion, unscreened pregnant women who are HIV positive. So these are the various sources of transmission of the HIV in the human race. So for prevention, unprotected sex should be avoided. Use of penile and vaginal condoms are necessary, and blood screening for HIV of the both sex partners should be done to avoid the transmission of this dangerous virus. This infection is contagious. It is passed from contaminated person to the healthy one, but it is present in the fluids of the body and secretions like saliva, tear, sweats, but it is not passed by these secretions to the other persons because blood contamination is necessary. But it is also present in vaginal secretion, semen, and so the sex, whether it is vaginal, anal, or oral, is the main source of transmission. Comparatively, anal function is most responsible for transmission as compared to vaginal and oral one. So, to check the and prevent the spread of this HIV virus, early diagnosis by blood screening for HIV presence and early treatment by the ART medications. They make the life of the patient comfortable, pleasureful, cheerful, because these medicines, they cut down the virus load in the blood and boost up the immune system, that is count of this CD4 and T cells in the blood. So due to this, the progression of the disease is checked by these medicines. Although this viral disease syndrome is not curable completely, but it can be managed. The person who is suffering from HIV positive can lead a normal life full of activities and responsibilities, provided he takes the preventive measures and the regular treatment of the ART medicines. There are various group of medicines included in this category, and the selective one or the more beneficial and effective one, they have been compiled up in the form of a single pill. So nowadays a single pill which consists of very efficient antiviral medicine, and that is taken on daily basis, and it is a long term therapy, or we can say a lifelong treatment, so that the stage of AIDS must be prevented, must be thrown away, because when AIDS has come in due to delayed treatment and diagnosis, then it is very difficult to make the person live a long life, because AIDS not only it attack and weaken the immune system, but subsequently all the organs and function of the organs like liver, intestine, brain, lungs, kidney, heart all suffer from the attack of this virus. Their ability, their capacity and their functional capacity is decreased one. Person become too much weak to lead further life. So in order to avoid the AIDS stage of infection, early diagnosis by the blood screening for HIV is compulsory, is necessary, and early treatment of the ART medicine is essential to avoid the AIDS, which is the last stage of the infection. So, in addition to the healthy weight, healthy and healthy nutrition, plenty of water, and aerobic walk, sufficient amount of fresh fruit, vegetables, vitamins, minerals, they are also essential to boost up or to the give strength to the human immune system. But the only step which is necessary to get rid of this AIDS is preventive measures. You must be hurry up in early screening, diagnosis, and treatment by the ART drugs.